Parents, today I want to give you 3 signs, painful signs, that your child may want to communicate but is struggling internally. The first sign I want to give you is your child pull your hand instead of talking. If you've seen that, just know that your child, he's struggling. He wants to talk more than you want him to talk. So when you see him doing that, it's because that sometime when he wants to say it, when he's trying to bring the words out of him, they fail him and he feels bad. So instead what he does, he take you calmly and take you to something he wants to show you. So that's a sign that the child has now started the journey of trying to communicate. And from then, that's when you should take your child for intervention. The second sign that I'm going to give you, your child become hyperactive when he's trying to focus and have attention or interaction with other people. Some children, they actually make attempt to sit with their family members, to sit with their friends, to sit with their mothers, and they really even want to stare the eyes and focus and have eye contact and look at them and get interested in what's happening. But they find the neurological energy they have got is very low, is very limited. That's why we still push for sport activities like learning games, jumping, football, so that this neurological energy and even nutrition, so that they can get enough neurological energy to sustain attention, to sustain interaction, to sustain communication. So some children actually make an attempt by themselves to sit with their parents and talk and even hear what they are talking, but the neurological energy become very low, and from there they get hyper. So when it goes low, everything goes fall apart. So they burst into hyperactivity and they start running around. So if you see that happening with your child, don't blame him. Don't think he's stubborn. Just know that he's suffering the same way you are suffering, maybe even more than you. The third sign I'm going to give you, which shows that your child might have actually started trying to communicate and he needs intervention as soon as possible, is the fact that your child, he can cry or throw tantrums sometimes. So when some children cry and throw tantrums, not because they are angry to someone or anyone, but because sometimes they feel misunderstood. Also, because sometimes they want to communicate, they want to tell you something, but then they find their mouth and jaw and tongue are failing them to speak. So when that happens, what do? They just cry. Why is this? Why was I born like this? Can't anything really change with me? So when you see them throwing tantrums, take it slow. Just understand that this human being, this friend of mine, this child of mine, he's not happy with the way he's not progressing with speech. So the same way you want him to speak, actually, he also wants to speak. What can you do? You can bring him here at Konga Therapy. Then we will help you with that. Or you can take this book and read especially chapter 7, 8, and 9 and see what are the daily habits you can do to actually improve your child's speech. Now, some parents are told that your child will never improve, but some children with cerebral palsy still show some signs that their nervous system is actually responding progressively. Today, I want to give you 3 signs that actually your child might be able to move or even walk in the near future. 3 signs. The first sign, your child has improved eye focus and attention. So if your child is at least now able to look at you in the eye, your child with CP When he looks at you, can see he has eye focus, he has attention. That's a sign that the frontal lobe and the temporal lobe are working very well, and even the limbic system is coordinating with them very well. Because by looking at you, it means even the cerebellum side, the cerebellum is also working very well. So if your child used not to have attention and focus, but now he has them, that's a sign that your child might actually be able to walk in the future. Of course, you can bring him here to Conga therapy to make it faster, but if you are doing some intervention like exercises, physio, or other intervention for your child, and eye focus and attention has improved, that's a sign that he might be able to walk very soon. The second one I want to give you is better neck control and posture. So if your child, before the neck was too weak, but now the neck is a little bit is stronger, and even when he's sitting, you can see he can last, let's say 30 minutes, 40 minutes, 50 minutes. My friend, that's a sign that your child actually might be able even to walk in the future. So keep doing what you are doing and don't allow anyone to discourage you. The third sign I want to give you is increased movement attempts and interaction. You know, some children with cerebral palsy, actually most of them, they understand like other children with speech delay. So they've got speech in their brain, but because cerebellum is failing to send clear signals to the mouth, jaw, and tongue to be able to move and talk, they end up not speaking. But if your child now, who is CP, now is pointing at something he wants, when he wants to communicate, he's using gestures, and he's also trying to attempt some movement, whether trying to lift himself or make any small movement around where he's seated, that's a sign that your child actually, with proper support, with proper stimulation, if you continue the same intervention you were doing, he might actually walk. We see many children here with cerebral palsy at Kirenga therapy. As long as they are below 2 years, my friend, in 2-3 months, they're able to stand. And when they stand, even speech comes. So don't allow anyone to discourage you. If you've seen these three things, better eye focus, better attention, better posture, and your child is attempting to make some movement, it is a sign that your child might actually be able to walk in the future. So keep doing what you're doing.